A presidential directive issued on June 1st of the year 2013 saw Kenya dropped delivery fees in all public healthcare facilities. A joy it was for mothers-to-be, as this would mean the burden of finances meant for deliveries would be lifted off their shoulders. Whereas this would bring about joy for expectant mothers, major issues have since emerged, those of neglected facilities, especially within the rural areas. Inaccessibility of these dispensaries, which have proven to be a major challenge owing to poor infrastructures, have led to increased and unsafe home deliveries, coupled with poor financial allocations to these facilities, which has made access to maternal health quite hectic. Our visit at Tebisonic Dispensary in Kericho County painted a story of a facility reeling from financial constraints. A recently delivered Mercy Kemunto says that lack of beds in the facility was one of the challenges she had to endure during her labor time.
Tunatumia hii kitanda ya tandarua ndio tena hakuna ngine. Ukisaa kwa hiyo tena unalala huko, kama kuna dispensary lingine mahali nimesaa hii wengine. Unakaa kwa ile mahali unasaa tena unalala hiyo kitanda. Inasabishwa na kulala hapo hiyo tandarua.
Because of that challenge of having one bed, we used to admit only one mother, and if at that moment we can have a mother coming at the stage of almost delivery, we used to ensure that we discharge the mother who was there even before time.
Miles away from Tebisonic, Mercy's sentiments are echoed by Jennifer Sigei, who is in charge of this health facility, who notes that referrals to other hospitals in the instance of dire need are the norm here.
Most of the time, tulikuwa tuna refer wamama kwenda Kericho County Referral Hospital. It's a bit a distance whereby pengine kama mama alikuwa very almost, ilikuwa inabidi tutafute taxi turush yeye huko.
Kitanda ilikuwa moja, ukikucha kusaa saa zingine unaambiwa enda Kapkatete. Na unajua Kapkatete hakuna kusugurikiwa. Ukienda kama wewe iko vile nilikuwa na shida, saa zingine wanakuambia bado masaa haijafika, enda huko.
Whereas maternal mortality has been on the decline over the last few years, the country has continued to record stillbirths with 362 maternal deaths per every 100,000 live births, which means for every live 1,000 births, 12 stillbirths are witnessed. In 2019, Kenya registered 73.6% of births and just 38.9% of deaths. Of these deliveries, only 61% were done by skilled personnel, with the remainder opting for home and traditional deliveries. Organizations such as Safaricom through the Ndoto Zetu initiative are now getting involved to save lives through donations to these facilities. This notwithstanding, challenges pertaining to poor infrastructure in accessing the facilities still abound, something that needs to be overcome to save women from losing the fruits of their wombs. Martin Opio, K24.